This lecture is entitled Introduction to Public Health Informatics. The objectives of this lecture are to define public health informatics, to understand why public health informatics arose as a discipline, and to describe some public health informatics data and applications. We'll start by defining public health informatics. It shares some of the characteristics of bioinformatics, which are discussed in a different lecture, but its area of focus and specific approaches differ. First, computers are used in some capacity for the analysis of or to model data. Second, the analysis and/or modeling involves health-related data of some sort, including genetics data, clinical data, epidemiologic data, and environmental data. Further, public health informatics doesn't just involve a person using a computer as a passive device to collect or visualize data, but rather, computers are tools for the use of mathematical, statistical, and computational algorithms to help us gain useful insights and organize and visualize potentially multiple sources of data. Considering all of these issues, the definition of public health informatics that we have settled on for this project is that public health informatics is an interdisciplinary field that combines aspects of computer science, mathematics, and statistics to collect, store, manage, analyze, and interpret biomedical data to improve human health. Let's discuss the origins of public health informatics briefly to help put some perspective of why public health informatics arose as a discipline. Data related to health have increasingly required use of computers for their analysis. The data is large in volume, it comes from heterogeneous sources, and there's widespread collection and potentially dissemination of information that we'd like to accomplish. And of course, computers can help us with each of these. So next, I will discuss some of the common data types used in public health informatics, and after that, a couple of application areas. Epidemiologic data first. So you may recall that epidemiology is the study of patterns, causes, and effects of health and disease in human populations. Epidemiologic studies try to understand relationships in populations based on samples of data. So we usually don't survey or collect data on an entire population, but we try to sample a portion of the population to represent the entire one. This may include the interview of people via phone, internet, or via in-person visits, gathering of biological measures, and making observations about environmental exposures and outcomes. Collecting data via carefully designed epidemiologic studies is among the best approaches we have to uncover health patterns at the level of populations. So just to give you an example, I will describe an epidemiologic study called the National Health and Nutrition Examination Survey, or NHANES for short. It's a study conducted by the U.S. Centers for Disease Control and Prevention to assess health and nutritional status of adults and children in the U.S. Questionnaires are completed via in-person home interviews and measures taken during a physical exam. Exposures are measured with monitors, and in different years of NHANES, exactly what exposures are measured may depend on the survey designed for that particular year. To give you a sense of what the study involves, the CDC sends out vans to specific locations across the U.S., and volunteers come to these vans for physical exams, as well as to complete portions of interviews. Here on the right is an example of a mobile examination center, or basically the path each subject may take, where first they enter a reception area, and then as you can see, as they go through, a variety of tests and/or data type is collected, including a blood draw, body measurements, interviews, taste and smell perception tests, etc. Next, I will discuss clinical data. This is another type of data used for public health informatics. When patients visit healthcare providers, data from encounters is recorded in electronic health records, or EHRs for short. EHR data from large numbers of patients can be used to understand health trends. Some clinical data is now collected by patients directly via apps and monitors outside of the healthcare system, but this data can be integrated into EHRs or sent directly to a research study. Environmental data. Many things in the environment influence health, and because of this, governmental and private entities collect a lot of environmental data, including pollution in the air, water, soil, weather, and data on the built environment. Air pollution is a specific environmental data type that we will cover in more depth in subsequent lectures, so I will briefly introduce it here. Air pollution refers to natural and human-made chemicals emitted to air, many of which affect health. The U.S. Environmental Protection Agency, or the EPA, monitors major pollutants across the U.S., and they make their data publicly available so that citizens and/or researchers across the country can view and use the data. Here's a picture of a single EPA regulatory monitor site, but keep in mind that these monitors are sited in urban areas as well. Here is a map where every black dot represents the location of an EPA monitor, so you can appreciate that they try to capture the whole country to have a sense of pollution that may affect all citizens. Social media data is another type of data that is the focus of some public health informatics efforts. Social media are forms of electronic communication through which users create online communities to share information, ideas, personal messages, and other content such as videos. And you're probably familiar with, or at least some kinds of social media data, including Facebook, Instagram, and Twitter. Social media also includes private online networks and sites such as Reddit. There are large volumes of user-generated content that can be mined for research, although exactly what data is available or can be used for research depends on the source. For example, Twitter data is publicly available, so it can be used without restriction. Other platforms may be subject to privacy, such as Facebook. The first application area I'll mention is disease monitoring. This involves the use of news reports, official health department reports, data collected via apps and/or social media to track diseases. And here's an example of a website called healthmap.org. It collects data related to various diseases with a focus on infectious diseases from around the world and integrates them into one place. If you want to see what diseases are near you, you can use this app to go and see what's near you. Researchers might use this website to get aggregate information on diseases for various regions or to monitor how they're changing over time. More recently, disease monitoring includes gathering information via apps and websites directly from people to understand disease presentations and spread. For example, as COVID-19 started to spread in the US and around the world, a site called covidnearyou.org was created to collect reports from people in the US, Canada, and Mexico. And this map shows some examples of COVID symptoms and result tests that are provided directly by individuals across the US. And the motivation here was that there was no widespread testing available for SARS-CoV-2 virus and no national efforts to collect disease information, so some research groups tried to come up with their own efforts, such as this one. Another application area that is related to the focus of our project is personal exposure monitoring. There are many exposures to monitor, some involving smartphones, others specific sensors used on their own or in conjunction with smartphones. Our focus will be the use of particulate matter sensors along with a smartphone app to monitor air pollution. Among the devices available for this is the AirBeam 2.5 sensor, which is a palm-sized device that collects particulate matter measures along with temperature and humidity. Measures can be saved onto a phone along with data location from the phone's GPS, and many measures can be displayed in web applications. This map on the right illustrates a collection of AirBeam measures in the greater Philadelphia area. You might envision how personal exposure monitors can help a single person understand their environment by providing reports. The person collects measures, these get stored onto a web server somewhere, and a report comes back to the person to warn them that there may be pollution or times of the day when they should avoid pollution. But as we've seen, gathering data from multiple individuals may give us more information on greater geographical areas. And this in turn provides more information that can result in research, policy, citizen awareness, and other group level or community level changes, as well as better personalized reports that now have more information that was aggregated from all of these individuals. So to summarize, public health informatics is an interdisciplinary field that combines aspects of computer science, mathematics, and statistics to collect, store, manage, analyze, and interpret biomedical data to improve human health. Data used for public health informatics includes that sourced from epidemiologic studies, electronic health records, environmental monitors, and social media. There are many public health informatics applications that collect and use this data to improve health.